My name is Bela Merkely, President of the Hungarian Society of Cardiology and member of the board of the National Society Committee. In response to the fact that the prevention of sudden cardiac death has become one of the major socio-economic problem in the region of Central and Eastern Europe, European Heart Rhythm Association has decided to focus more of its attention and resources on this topic. It issues a call for action to the medical communities and to the public and this respected region. The first ICD for Life summit was held in Budapest in 2010 with more than 200 participants from 31 countries. It follows by further meetings, and now the current campaign takes its tradition further. Dear Professor Goran Milasinovic, could you tell us about what called ICD for Life initiative into life?
Like you told in the introduction part, we recognized in EHRA a huge disparity among the Eastern countries. And we think that the ICD for Life initiative is very much important to increase the level of the awareness of the sudden cardiac death and the arrhythmia burden in the region. So after the first very successful meeting in Budapest, and before that the meeting in Pilsen, where we detected the problem, we realized that in the region there are very developed countries and the countries without any structure and any arrhythmia treatment. So we think that if we promote the ICD for Life initiative, it is far beyond just ICD implantation. It is a huge amount of the information regarding the sudden cardiac death and how can we decrease this. And we think that the education is very much important part of this. So everything together, if we can increase, then the sudden cardiac death will be fighted in the eastern region, the same like in the west.
Why is the use of implantable cardioverter defibrillator so important in the prevention of sudden cardiac death in that specific region?
According to the evidence that we have from the clinical trials in the last 20 years, we are now pretty convinced that the best way to save the lives and to prevent sudden cardiac death in selected patients, meaning patients with a high risk for sudden death, is implanting the ICDs, the implantable cardioverter defibrillators. Nothing else is able on that amount and that percentage save the life like ICDs. But as we know that the outpatient, out-hospital survivor of the patient faced with a cardiac arrest is just 5%, we think also that the awareness of the sudden cardiac is important. So if in the eastern countries, for instance, the external automatic implantable defibrillators could be concentrated on the most important public places, that can decrease the mortality of the cardiac arrest in the eastern countries. And still we have the problem, and maybe this is the most important objective, in eastern part of the Europe, that the cardiovascular mortality is still very high. So we still have like 55, 56 or 57% of all death caused from the cardiovascular diseases. And in the west region it is different, it's far below that. In France it's not more than 37 or 38.
The ICD for Life initiative and campaign of EHRA consists of two elements: the Sudden Cardiac Death Awareness Day and the Eastern Initiative Summit. Could you introduce them?
The Sudden Cardiac Awareness Day is a part of the initiative, and that means that we will promote that in all eastern countries, which means from the border of the eastern border of Austria to the far east, actually, which is 500 million inhabitants. So it's a huge region. We would like to promote one day, which is the day in the first week of December, where we will where we will advertise actually the importance of the sudden cardiac death prevention. So we would like to organize from the EHRA on the same day or on the same week, first week of December, all the actions that will make publicity more warned about the sudden cardiac death. The EHRA will make the toolkit for this campaign, which means brochure, videos, then how we can increase the knowledge of controlling heart rate, pulse, how can common people recognize atrial fibrillation, for instance, which is a very important arrhythmia in the region. So we'll make a lot of different actions in all central towns in the region to promote this Sudden Cardiac Awareness Day. The initiative itself and the summit itself will promote this Awareness Day, but at the same time as the continuation of Budapest meeting, this Belgrade meeting, 19 and 20th of October this year, will make again the bridge between the professionals, the politician and industry. It's not a scientific type of the meeting, means that we will not talk about the studies, about the results, about the controversies. Then we will discuss together with the politicians, together with the decision-making people, industry as well, patient organization and media, how we can all together increase the awareness of the sudden cardiac death. First of all, we detected the problem. Now we know that we need to increase the level of the knowledge, and the meeting itself will give us the idea how we can do that. Out of this, we will try to promote at least 4 or 5 countries in the region out of 20 or 22 countries where the actions are very much the most important at the moment. And we will try to identify what kind of assistance and help from EHRA and from the eastern countries who are already very good developed can use to increase the level of the knowledge and the arrhythmia treatment in that region. So if it is 3 or 4 and we can do something on a realistic, concrete basis in 2013, we will be happy, and I think we are going to have the good results of this initiative.
So we would like to invite all of you to the next EHRA summit, to the next ICD for Life summit to Serbia in October.